right, I show 8:30. I will call to order this meeting of Board of Franklin County Commissioners for Wednesday, April 15th.
Commissioner Stottlemyre? Commissioner Howard?
Present.
Chair Waymire?
Present?
Commissioner Dickinson?
Present.
Commissioner Dunn?
Present.
All right, if you'd join me for the Pledge of Allegiance. I pledge allegiance
Allegiance to the flag,
United States of America,
America, and to the republic,
The Republic.
which it stands,
one nation,
one nation, under God, indivisible, with liberty and justice for all.
For all.
All right, thank you. Reverend Hendricks, are you on?
I am.
All right. Go ahead if you would, sir.
Heavenly Father, thank you for this day. Bless this meeting. Fill our minds with your thoughts. Give us the wisdom to decide the things that need to be decided and the courage to do what you know we have to do. Lord, bless this time for your service and our county. Help each of us to be your agent and to know, above all else, that you are in control. We pray this in your name. Amen.
All right, thank you, sir. That was Reverend Dr. William Hendricks from Wellsville Baptist Church. That brings us to correspondence and organizational business. Derek?
I don't have anything today, Colt. Thank you.
All right.
Don Stottlemyre's on.
All right, thank you, Don. I'm going to jump to public comment. Janet, do we have?
Today.
All right. Consent agenda today would include consider approving minutes from our April 1st meeting, claim vouchers in the amount of $525,050.64, and tax change orders in the amount of negative $763.24. Is there a motion to approve the consent agenda?
This is Commissioner Howard. I'll make the motion. Commissioner Dunn, second.
Commissioner Stottlemyre?
Yes.
Commissioner Howard?
Yes.
Commissioner Dickinson?
Yes.
Commissioner Dunn?
Yes.
Chair Waymire?
Yes. All right. This is Chair Waymire. We'll move on to items of business. The first would be to consider for approval the Health Department's first quarter 2020 report. We should have Robert Walker here from the Health Department.
Good morning, Commissioners. In the Health Department, where I think you have our program summary for this quarter and our write-off amount, and we're asking that the write-offs for this quarter be approved in the amount of $521.14. And if there's any questions, be happy to entertain those.
All right. Does anybody, this is Commissioner Waymire, does anybody have any questions for Mr. Walker? All right. Is there a motion to approve the fourth quarter?
Motion approved, Don.
Is this,
Should be first quarter.
okay, all right, yep.
I'm sorry.
I see on the specific action requested, it's just listed as different. So
Oh.
is there a motion to approve the quarter one 2020 write-offs in the amount of $521.14?
Don Stottlemyre, motion to approve.
All right.
Commissioner Dickinson, I'll second.
This is Janet. Commissioner Howard?
Yes.
Commissioner Dickinson?
Yes.
Commissioner Dunn?
Yes.
Commissioner Stottlemyre?
Yes.
Chair Waymire?
Yes, all right, this is Colt. We're moving on to our second item of business.
Can I just make one comment? This is Commissioner Dickinson. Can I make one comment about the
Go
Health
for it.
Department before we move on? That
You bet.
with all of this that's going on, how much I very much appreciate this department, especially, and all the work that they're putting in to keep us all safe. I appreciate it very much.
Thank you.
You bet. All right. Appreciate that comment. This is Commissioner Waymire. Our second item of business would be consider awarding the 2020 dust control bid to Scottwood Industries in the amount of $1.08 per gallon. David Lee, Public Works Director, are you on?
Yes, sir. So,
All right.
Commissioners, we are ready to move forward with the dust control application for this year. We sent the bid package to a few different companies. Once again, Scottwood Industries is the only one that replied. They have raised their prices by 1 penny per gallon, which is seems to be fairly standard for them. It goes up ever so slightly each year. This year, we've only got 88 locations. That's down from 116 from last year. I suspect that that this is suffering a little bit from the COVID-19 virus uncertainty, but that's just speculation on my part. But we are ready to proceed with this, and we already have a pending approval of this. We've got an application date scheduled for next Monday. So this will happen right away, and we'll give our citizens a good deal of time where this coverage will be good for them.
All right. Any questions for David?
Are you planning on, this is Commissioner Dickinson, are you planning on them doing the water this year?
It again depends upon the how much moisture we get towards the end of this week. If we get rain like they're expecting, there won't be a need for applying water. If it doesn't rain, then we will take care of that ourselves with our water trucks.
All right. Is there a motion to award the 2020 dust control to Scottwood Industries in the amount of $1.08 per gallon?
This is Commissioner Dunn. I approve the dust control program for 2020.
A motion from Commissioner Dunn. Is there a second?
Commissioner
Howard, I'll second it.
This is Janet Paddock. Commissioner Dickinson?
Yes.
Commissioner Dunn?
Yes.
Commissioner Stottlemyre?
Yes.
Commissioner Howard?
Yes.
Chair Waymeyer?
Yes. This is Colt. Our third item of business also lies with the Public Works Department. I'll let David introduce it.
Okay, Commissioners, we have a site just north of Lane on Virginia Road, north of the bridge, that my understanding, every time we have significant floods, we have a severe erosion issue that happens on the east side of that Virginia Road there. And this last year, with the multiple floods that we had, it really, you know, if you looked at the pictures that I included in the packet, you can see that it eroded right up to the edge of the road. And we were very concerned that we would lose part of that road. We had the opportunity to visit with KDOT as a part of this response to the floods. So we've met with FEMA folks on our gravel roads and our secondary roads, and KDOT, by way of the Federal Highway Administration, administers a different funding mechanism for our FAS routes. So Virginia Road, Rock Creek Road, those major thoroughfares. And in visiting with the KDOT folks, they identified this as a project that would be eligible for federal highway funds to come up with a permanent solution for this erosion issue. Since it happens on a regular basis with these floods, rather than just continuing to patch it back together and hoping that we don't lose the road, this is more of a hopefully a permanent solution so that we don't have this issue going forward. And so we are working with Cook, Flat, and Strobel, or we would like to create the design for this erosion control, this ditch lining project. The construction of the project will be funded with an 80-20 grant through the Federal Highway Administration, being administered by KDOT. And so engaging an engineer in the design of this is kind of the first step in that process. And so we're asking the commission to approve a contract with Cook Flat and Strobel CFS engineers in the amount of $7,000 for the design and plan preparation for this emergency relief ditch lining project on Virginia Road, just north of Lane. The preliminary estimates we have at just over $100,000, of which 80% will be reimbursed through this ER program. So we have funds available for the matching portion of that through the money that we save each year for our bridges. I think this is an appropriate use for that. And so I have attached, the project location, various pictures of the conditions. I've also attached the contract with Cook Flat, along with some information from the Federal Highway Administration that kind of spells out how these emergency relief funds are to be used and spent. So provided all of that information, I'd be happy to answer any other questions that you might have. I will also mention that funding for this project is probably not going to occur until 2021. So we have the rest of this year to get the design done and work through. We'll treat this as a regular KDOT project, so they will be heavily involved all the way through. And again, getting the design done and submitted and approved is the first big step in that process.
This is Commissioner Dickinson. Is the cost of the design included in our 20%, or is that on top?
That is on top. Cook Flat and Strobel, they were very, very helpful in when we had these floods. They came down on a number of occasions to assist us with the Idaho Road Bridge, for instance. They came down and provided some guidance for us just to make sure that we were headed in the right direction. They did the same thing on the low water crossing on Haskell Road, and when we had this, when we finally got to see the damage that occurred on Virginia Road, they walked that site with us, and we talked about various ways to mitigate this and to help keep this from happening. So they have gone out of their way to help us. And this $7,000 is fairly minimal, and I would like to, it's my recommendation that we proceed ahead.
This is Commissioner Waymire. The emergency relief packet specifies a minimum $700,000 widespread damage.
That is, yes, sir.
That's statewide?
Yes, it is.
Okay.
And so this, the KDOT personnel went out all over the state and met with Public Works Road and Bridge agencies in other counties, and they more than surpassed that $700,000 limit. And our project is certainly over the $5,000 threshold for a local project. So they identified this one amongst hundreds of others across the state as one that they would like to fund and take care of for us.
This is Colt. That's good. There's been so many occurrences of rain and flooding. I didn't know if that particular one, but that's good. Good to know it did. So.
Yes, sir. So just to reiterate, KDOT and the Federal Highway, they take care of our major FAS routes. And so all of the FEMA documentation that we have been doing, part of that will go to KDOT for those FAS routes, and the rest of it, which is the vast majority of it, will go through FEMA. And just to give you a brief update on that, we have our Because of the stay-at-home orders, we have postponed our meeting with the Kansas Department of Emergency Management on behalf of FEMA to have our initial scoping meeting for the FEMA documentation. So both of these items are moving forward, albeit slowly, but they are moving forward, and we do look to receive funds back from FEMA and now the Federal Highway Administration.
This is Commissioner Stottlemyre. I'd just like to make a comment. That area there has been a problem for, I bet, 50 years, over 100 years, probably. And it's hard to tell how many thousands of dollars Franklin County has pumped into that. And that area right there, if that road does go out, even when we have floods down there, we have to get ambulance service out of Anderson County because we can't even get an ambulance there from Franklin County. So that means if that road goes out, we got to start getting our ambulance service out of Anderson, or we got to venture about 30 or 40 miles out of the way to get around the other side. So I congratulate David for finding us a way to get this done with a very minimal cost, and I think it'll relieve a lot of headaches for years to come.
This is Colt. Any other questions for David? All right, would somebody like to make a motion to execute the proposal from Cooks Flat Strobel Engineers in the amount of $7,000 for the design and plan preparation for the Virginia Road Ditch Lining Project?
This is Commissioner Stottlemyre. I'd like to make that motion.
Commissioner Dickinson, I'll second it.
This is Janet Paddock. Commissioner Dunn?
Yes.
Commissioner Stottlemyre?
Yes.
Commissioner Howard?
Yes.
Commissioner Dickinson?
Yes.
Chair Waymeyer?
Yes, Mr. Chair Waymire, I will introduce the fourth item of business, which is to consider awarding culverts to the culvert bid to J&J Drainage Projects Company for 43 various pipes and the amount of $21,119.40. David?
Commissioners, as you might be aware, we have installed and dropped off a number of culverts over the last several months, mostly due to failures and being upsizing crossroad tubes and that sort of thing. We've also sold a number of tubes to area residents and farmers for their use. And so this bid is really to replenish our most used size tubes. The 15 by 30, the 18 by 30, and the 24 by 30 are generally the ones that we use in most situations. And we really need to replenish our stock so that we can continue with the work that needs to be done.
All right, this is Commissioner Waymire. Would anyone like to anyone have any questions for David first? All right, would anyone like to make a motion to award the bid to J&J Drainage Products Company in the amount of $21,119.40?
This is Commissioner Dunn. I'll make a motion to award the bid for the culvert project.
All right, is there a second?
Commissioner Howard, I'll second it.
This is Janet Paddock. Commissioner Stottlemyre?
Yes.
Commissioner Howard?
Yes.
Commissioner Dickinson?
Yes.
Commissioner Dunn?
Yes.
Chair Waymeyer?
Yes. This is Commissioner Waymire. Our fifth item of business is to consider for approval awarding tire bid number 1, 5, and 7 to D&D Tires, tire bid number 2, 3, and 4 to Pumps Tire Cross Midwest, and tire bid number 6 to Goodyear Commercial Tire. David?
Commissioners, this is pretty standard fare. Again, we are trying to replenish our stock. so that we have tires on hand whenever we have tire issues, which with as many big trucks and tractors and motor blades and those sorts of things that we have on the road, at any given time, we go through a substantial number of tires each year, and this is an effort to replenish that stock so that we have these on hand when we need them. I'd be happy to answer any questions that you might have.
All right. Is there a motion to award the tire bids as noted?
This is Commissioner
Howard, I'll make
Dickinson.
the motion.
All right, Commissioner Howard, had made the motion. Commissioner Dickinson, would you like to make a second?
Commissioner Dickinson will second the motion.
All right.
This is Janet Paddock. Commissioner Howard,
Yes.
Commissioner Dickinson,
Yes.
Commissioner Dunn,
Yes.
Commissioner Stottlemyre,
Yes.
Chair Waymeyer.
Yes. This is Commissioner Waymire. We'll move on to staff reports. Derek, you have.
Yeah, thanks, Colt. This is Derek. I'll start by giving just a very, very global overview of the county's COVID-19 response, where we're at. I've got Nick and Alan on the phone, Jeff Richards on the phone. They'll be able to dig into it in a whole lot greater detail. Suffice to say, 99% of my time over the last 2 weeks since we met has been spent on COVID-19. I'm generally just barely treading water on the other obligations because this has continued to be, an incredibly strenuous, ever-changing pandemic. And so I'm pleased with where we're at. Communication's been very good. We've continued to work incredibly well, both internally, and we're working well with our partners on this. OSP's been amazing to work with. Dr. Ransom over there has been great to work with. Communications with Advent Health have been improving. Generally pleased with where we're at. I worry about what the future looks like. I don't think we are at our peak at this point in time. I think we've been fortunate in that our citizens generally have been listening. They have been social distancing, and that's been reflected in the low number of positives that we've had. I think we all thought we would have more than this by now, and it's incredible that we're at the number that we're at, and every day it seems like we're adding anywhere from half a dozen to more negatives to that. So that's great. That being said, we're getting to a point where the state's stay-at-home order is about to expire, and I will tell you it's a mess in Topeka. I think we all anticipate that the governor's order to stay at home is going to extend through May 1st, but they've managed to bungle this in a way that they are not going to be able to extend it past May 1 without convening the entire legislature. And so the guidance that we are being given as of yesterday is basically to sit tight because nobody up there really knows how this is going to go. That's obviously problematic for us because we need to know what we're going to do here in Franklin County. And so what I would ask is that, we've been somewhat fortunate over the past couple weeks in that we have just been subject to a state's order, and in some ways that's made it easier, but I'm not sure what the future holds for us. So it would probably be a good use of the commissioner's time to start thinking, okay, do we want to think about the potential of implementing our own order again should the state, you know, not be able to figure out what they want to do? I think so much of that will depend on what our numbers are, and you'll get plenty of guidance from us on that, but it is worrisome that, you know, nobody seems to have any idea of what this is going to look like come May 1. I have started, albeit slowly, to start really thinking about the financial ramifications of all of this. You know, the time the last couple of weeks have been spent with Nick and Alan trying to fortify our processes within the health department to make sure that, you know, we are all getting ready for this push that luckily hasn't happened yet, just making sure that we have solid communication procedures in place, solid reporting procedures, investigation procedures, and I think we're good there. Financially, we're going to learn a lot next month. We're scheduled to get our second half tax payments then. We'll see what those receipts look like. That's going to tell us a lot about, obviously, what we're looking at in 20. My bigger concern is 21. I had a nice conversation with the appraiser yesterday, just talking about values and what we could potentially be looking at. He has not seen the decline yet because all of the sales he's seeing were still originated from 30, 60 days ago before this really became a thing. But certainly we both anticipate the volume of sales is going to drop, and you know, I don't see how values aren't going to do the same. And so depending on what that looks like, you know, if our 2021 valuations are way down, then obviously we're going to need to be in a position to address that. You know, this is a conversation that we're going to have, Janet and I are going to have with the commissioners, but I think obviously we have to prioritize protecting the services that we provide. Which means that, you know, I've already started telling my staff, you know, the spending in the normal course of business obviously can and needs to continue, but to the extent that there is discretionary spending, and we've talked about that with the board, you know, we've talked about new software, which was going to be $1 million expense. We've talked about remodeling at the annex, you know, painting the old courthouse. I mean, a lot of these things, I am recommending we pump the brakes on for now, just because I just don't know what 21's going to look like. And I want to protect, obviously, our ability to provide our services. I want to protect our ability to give our employees raises. I want to protect our ability to absorb the increase in our benefit costs. And so it's really tricky right now to decide, okay, what projects are clearly maintenance that need to be done and what projects are just discretionary. And so that's something that we're starting to work through with staff, and certainly would take any guidance that the board has. You know, like the annex parking lot, of course, we're still going to move forward with that. I mean, we're not going to stop maintaining our buildings. I just think there are some that are kind of difficult judgment calls that need to be made, and I am innately going to err on the side of caution because we don't know what the future holds. I said this a couple weeks ago. We are very fortunate here in Franklin County that we don't rely on a ton of sales tax revenue, because cities are really taking a beating right now, and then they're taking it immediately because they're watching that sales tax revenue just decline. We don't really have that issue, and so in a lot of ways, we're in a decent spot. That being said, do any of you have any questions for me about any of that?
I have
This is Commissioner Dickinson. I have two comments. One of the things that I'm kind of concerned about is with you all is burnout, to make sure that you don't, especially since we haven't hit our peak probably yet. And I know you're already spending a lot of time, but make sure that everybody has a chance to decompress or whatever they need to do to make sure that we can keep you all healthy and sane as we continue forward. And the other thing that I had thought about that might be a concern for next year is what our health insurance premiums might look like when we get through all this. So a couple of things to think about.
And I appreciate that, Ian, and obviously, we won't know for some time on health insurance premiums. In terms of burnout, that's something we talk about, but I think you're fortunate. You know, we have got a really good team, and not only are, you know, not only I think about guys like Nick and Alan and their staff and Casey and Janet, and they're intelligent and they're hardworking, but they're also gritty. I don't think at this point, at least the team that I work with directly, is anywhere near burnout point. In fact, we've all talked, and nobody wants to be in this situation. This is it's a terrible situation to be in, but in some ways it's bringing the best out of us. You know, when you feel like this is, our response to this is absolutely critical. And it's inspiring in some way, and I think we're seeing, for a lot of us, it's bringing out the best in us. So that being said, I can't possibly, you've worked with me for 5 years, you know I believe giving staff shout outs. I couldn't possibly give a shout out to everyone who needs one, but what I will say is there are a lot of people who, you know, it's easy to look at the leadership team, and certainly they're worthy of praise, but if you think about the staff at the health department, Robert Walker, Aaron Laurie, Jennifer Watkins, like, they have stepped up into leadership roles, and they're leading by example, and it's made Nick's job so much easier. Very happy with them. We all know that Alan Radcliffe is very good, but I don't think Tom Winter, his assistant, gets the credit that he deserves. He has done so much during this response, and so certainly want to give him a shout out. Sheriff Richards and his staff have been doing good work in terms of, we have had a couple of people who, you know, have made false claims about having this virus, and in doing so, they've caused a panic, and the sheriff and his staff have done a great job of stepping in and helping prevent that from happening. So there's so many people that have been involved in this that I personally don't take for granted. I certainly don't want you as commissioners to take them for granted, because it's, you know, they've done a heck of a good job. If there's nothing else, I'm ready to turn this over to Alan.
This is Commissioner Waymire. Derek, you mentioned at some point seeking guidance on capital projects from us. Is that something you wanted now? Something you wanted us to think on and come back to it later? What is your thoughts there?
Yeah, we can absolutely have the discussion now, or we can, you know, I can put it on in the next agenda that we have, and we can discuss it then. I mean, what I'm talking about are, here a couple weeks ago, you approved, it was $20,000, give or take, for a carpet replacement in the annex, and you've already approved that, but that's one that for the time being, I'm holding, and certainly if it's the desire of the 5 of you to go ahead and proceed on it, I absolutely will. That was one that, was a little closer to that line. Is it maintenance or is it discretionary? And then you've just, the other big one right now is the painting of the old courthouse. That's a big expense, but we can offset a lot of it with transient guest tax funds. So it's not like we're using ad valorem dollars, and there is some benefit to potentially doing it now while it's not open to the public, because you are going to have concerns with lead paint and whatnot, and we're being told by the painters, yeah, it'd actually be a great time to do it. It's really, and then the annex remodel, I've kind of just assumed we would put that off until we got on the other side of this. But those are really the three that come to mind. District Court HVAC, that's going to need to be done. Annex parking lot, that's going to need to be done. Those are much easier. But the carpet in the annex remodel, and the painting of the old courthouse, if you all have opinions on those today, then yeah, let's absolutely share them.
Commissioner Howard.
All right, this is Commissioner Waymire. I think we're going to have a traffic jam here in a second. So let's start with the District Court HVAC, and I'll go down the roll call line. Commissioner Howard, I'll give you the floor.
I think we ought to hold off on everything we can for at least a couple of weeks. A lot of things can change in a couple of weeks or so, and I don't think any of that is something that we really need to rush into too much, especially the carpet and stuff like that. I agree with Derek. We got to continue our maintenance, but there's some things like the carpet that definitely can wait. The only thing I was actually going to throw out there is Derek mentioned the transient guest tax. I'm sure that's going to take a pretty good hit out of this whole situation too. There's not many people traveling, so that's going to take a hit. So we'll have to see where that's at when this is all over too. That's pretty much all I have.
This is Commissioner Waymire. Commissioner Dunn, I heard you say on the annex carpet you'd be in favor of waiting. What about the courthouse painting and District Court HVAC? What are your thoughts on there, given one of them's the HVAC and the other one the painter? There may be some utility in doing it now.
This is Commissioner Dunn.
Hold on, Roy.
Okay.
Commissioner Howard, what were your thoughts on those?
I'm okay with holding off for a few weeks and see where we're at.
Okay. All right. This is Commissioner Waymire. Commissioner Dunn, the floor is yours.
Hey, Commissioner Dunn, I feel like Commissioner Howard, we can hold off on some of those things for a couple weeks and to see what happens and go from there. Those don't seem critical right at this moment, so I agree with Commissioner Howard.
All right.
Hey, can I jump
in
for a quick sec?
Yep.
Obviously, I am A-okay waiting, but our situation financially, we're not going to know much of anything different 2 weeks from now. And I think if you wanted to revisit this at the end of May, after our second half tax payments have come in, and Janet, jump in if I've got that timeline botched in any way, but I just, before we go down through the rest of the commissioners, waiting 2 weeks, I don't know. We'll know a lot more about COVID and where we're at, but in terms of the financial ramifications, I would say at the very earliest, you're looking at 6 weeks and probably a lot longer to really have a good understanding of where we're at financially. So I just wanted to throw that out there so that we all have that understanding.
All right.
This Commissioner Dunn again. I feel like the second half taxes are pretty well set for this taxing season, so I don't think you'll see any difference then than maybe following year, basically. So I think we can hold off, or we can go ahead with those projects either way, because I don't think those taxes are going to be any different on the second half taxes coming in.
Well, this is Chair Waymer. I believe what he was saying is revenues, like how many people are actually able to make them, and making sure that we get obviously the rate stays the same, but the actual cash comes in. As Derek was saying, this is potentially going into recession, so our long-term finances is what we're looking at. What are your thoughts, Commissioner Dunn? Is the HVAC and the painting, for instance, would you consider there's more a maintenance issue that needs to be done at some point regardless, because they are, necessary for maintaining our investment in those facilities, or are they, what are your thoughts on that?
Commissioner Dunn, definitely the courthouse probably needs to take precedent, I would guess.
Okay, but
over the painting.
Okay. Commissioner Dickinson, what are your thoughts on these projects?
This is Commissioner Dickinson. I don't know if Brandon Sands is on the phone, but I have no problem with putting off these, but I also don't want to go into the middle of the summer and then have the air conditioning system quit working and then having to do something at that time, quickly, instead of doing something that was being planned. So don't know how bad that system is that it would have a problem in the middle of the year.
Okay. Commissioner Wayman, all right, got a good sense that the district court HVAC is a priority to you. Commissioner Stottlemyre, what are your thoughts?
Yeah, I kind of agree with Diane on the air conditioning, and that's been a real problem forever and ever and ever, and probably double the cost if we had to do it in an emergency mode. On all the other things, I'd like to see Derek give him more time, him and Janet, to come up with some good numbers and figures of where we're headed, even if we got to wait another 45 to 60 days. I don't think there's any push on any of the other. And one other thing, Derek, I wanted to ask you a question.
Yes, sir.
Where are we at on the hospital, and are they about to run out on their lease or what? Of the administration office.
They are already out, Commissioner
Okay.
Stottlemyre, and they have been for some time. I've actually got Chief Robbins in Suite 2 utilizing some of that space. We're trying to do our best to obviously use social distancing, so we're kind of starting to expand into there for the time being. But yeah, Advent Health has been out for.
I think that we need to give you a little more time to come up with some good numbers. I kind of maybe put the air conditioning at the forefront. That's something, a little different than paint and carpet and so forth. So that's the way I kind of feel on, and we don't want to be alarming, but if you mentioned the transient tax, if this continues, we may have a couple of big money drawers that may not be coming through. We don't know that yet, but so it's something we might want to keep our eye on for the next 60 days. That's where I stand.
This is Commissioner Waymeyer. All right, thank you, Commissioner Stottlemyre. I want to double back, just Commissioner Howard real quick. We've had a lot of conversations since you had the chance to speak. Is there anything you wanted to add?
Not really. This is Commissioner Howard. I'm pretty much on board with the rest of them. I think definitely the air conditioning is the top priority, and I think we can just go. I kind of agree with Commissioner Dickinson that Brandon and Derek and them can look at that, discuss that, and see where that needs to go and how quick, and the rest of them we can kind of put on hold for a while.
This is Commissioner Waymeyer. I think I'd agree and with what everybody said, and I think we had a good conversation there, and that's plenty for Derek to.
Commissioner Dickinson, can I make one more? I have one more question.
Go ahead.
If we are not moving forward with, have we moved the HR department back into the suites or not?
No, we haven't yet, but the HR department, is working from home. Sari is the only staff member that is in that suite, and we've talked. She's comfortable. The other two are working successfully from home. Tammy is at home. And so what we're really using Suite 2 for at the time being, Suite 1 we're using for COVID testing. Suite 2 we're using just for overflow for the health department so that they can spread out as need be.
All right. This is Commissioner Waymire. I'm going to move down the list to Alan Radcliffe, Emergency Director.
Before you do that, Colt, let me I want to just summarize what I've heard so to make sure we're all on the same page. So District Court HVAC is pretty clearly a priority. One that you didn't discuss that I recommend we move forward with is the annex parking lot, getting it coated and painted. And those are the two, it looks like, priorities, or I would recommend the annex lot. You're recommending District Court HVAC. The others, the carpet, the painting of the old courthouse, the remodel, we're going to hold off on those. That is my understanding. If that is incorrect, then please let me know.
All right, so District Court HVAC and Annex Parking Lot Project would be our priorities. Does anybody disagree with that? Don't hear that. All right.
Thank you.
Good.
Sir.
Moving forward, Derek? All right.
Yep.
Okay. Alan, go ahead.
Yeah, this is Alan Radcliffe. Can anyone hear me?
We can hear you.
Okay. Just give you as brief as possible an update as to where we're at. 2 weeks ago, I believe I informed you that we were state of Kansas was approved for a federal declaration, which is good news for us on the reimbursement side. We have been tracking our costs, working with Janet to make sure that our costs are being accounted for. We don't really have any guidance other than that right now as to what will be approved, what won't be approved. So we're tracking everything that we can at this point. The national stockpile that in Kansas because of, and I believe that's because of the stay-at-home order and the good job that Derek had talked about, not only for the county but for the state, keeping our numbers low. We really, in Kansas, are not a priority. A lot of the national stockpile is being pushed to the East Coast where they're having, 40% of the COVID cases are in New York. So, of course, they are a priority. There still are senators and representatives at the state and national level are pushing for us to get what we can. The state has ordered personal protective equipment. It is slowly coming in, and when I say they've ordered it, they've ordered several $1 million worth. In our conversations with just yesterday with the Advent Health and first responders and our healthcare providers, nursing homes, we feel that right now the personal protective equipment inventory is adequate for right now. And the burn rate, which is what we're using daily, is low because of the number of cases, but also because we've done a lot of education and people are conserving the personal protective equipment. It's also being reused after it's decontaminated out at Advent Health. They've got a place set up where their N95 mask can be decontaminated and reused again. So that's helping us with the personal protective equipment. And as you know, American Eagle gave us a donation of masks. Most of those masks have been pushed out. We were contacted by them yesterday, and we're working with them. They want to do another donation to us also, so we're working to see what that is and how that's going to work out and how we're going to get that pushed out to everybody. So American Eagle is being a good partner with us. Also, Walmart's another company that's a very good partner with us for making sure we got hand sanitizer and the disinfecting wipes that are needed to keep all of our responders and our employees safe through this. We also are doing a weekly briefing, and that is every Monday morning. We're briefing with all of the EOC staff by same type of meeting as what we're having here. It's kind of different for us when we're normally used to coming into a room, but we are getting by with it. And as Derek alluded to, the communication, it's really, to me, it's a struggle for us to communicate in this fashion, but it's getting to be the norm. So I think that's also improving for us too, on conference calls and stuff instead of our face-to-face like we've normally done in the past. We're also with ESF 8, which is Emergency Support Function 8, that is EMS and Public Health. We've started doing 2 conference calls a week with EMS, Advent Health, Public Health, and the Emergency Operations Center. And I think that's improving our communications also and working out any issues that we have between those agencies and departments. We also, Nick will probably add on to this a little bit, but yesterday we had a conference call with Public Health Officer Bud Ransom, and he agreed the same as what we've been seeing, that the stay-at-home order is working just as it's supposed to be. And I know, Ian, you talked about this a little bit about burnout and stuff. I think everybody, not only our employees and our workers, are under a lot of stress, but also our citizens being at home are starting to see the effect of being at home for 2 or 3 weeks and wanting to get out. And I've received several phone calls from people wanting to know when this was going to end. And I think we're at the point where I know it's a little bit of a strain for some of us, but we need to continue, and we really need to push out to the public that it's working. And if we'll just hang in there for another 2 or 3 weeks, keep an eye on where our numbers are going, then I think we're going to really see some benefit from the stay-at-home order. And Dr. Ransom also agreed with that. One of the other things Dr. Ransom noted yesterday in our conversation too was he would like to see more of the public wearing face masks. And it's not the fact that it's for their protection, but it's for everybody else's protection and the community's protection, because they're seeing a lot of people that could possibly have be exposed or have the COVID virus and not know that they've got it, so they could unintentionally be spreading it, which is also why the stay-at-home order is so important. And I have seen more vehicles around town this week than I did last week, so I think some of our people are getting a little lax at staying at home, but we really need to push forward and continue to do that. And our businesses are being very cooperative with us too, the ones that are essential and are open in the social distancing side. So I think we're seeing some good things come out of this. As we all know, this is something that we've never dealt with before, but I think we're still a few weeks out before we can rest easy. And just for the fact that we did have Easter this last weekend, I believe that we had several families get together thinking that everything is okay, and we'll know probably in another week or so if that was true or not. So we still don't want to be complacent, I guess is what I'm trying to say. I know, Commissioner Stottlemyre, you talked about some of our large events. We've already been contacted by some of the events, the county fair, the car show, and the tractor show. They're wondering what it's going to look like. Well, I think that's what several of us are kind of wondering, what things going to look like in the next few months. And those are things that we're working on and will continue to work on the next few weeks. I know K-State, and this affects the Extension Office, put out a memo to where they're not having any face-to-face meetings or contact until after July 4th, and most of their people are working at home. Well, for the county fair, that could cause some issues for our county fair, which if they run until July 4th, our fair is usually 2 or 3 weeks after that. So we've got some work that needs to be done, and we are seeing a lot of meetings and events that are being canceled or dates are being moved till the fall. And even some of the fall events are already being canceled across the state. So I think we can't say right now, but I think we were looking, and our first response group, public health and the hospital are looking 2 weeks out. And the way things are changing for us, 2 weeks is just about as far as we can look out, and even there's times that doesn't even work for us because of the way things are changing. So it's continuing to evolve daily, and there are changes. I do agree with Derek. I believe they're going to, there'll be an executive order sometime this week from the governor extending the stay at home to the 1st of May. There's also some talk at the national level about getting the economy back running again, and I think there's a fine line that we have to walk. And if you will remember, we talked about this when we did the declaration to extend it for 60 days, that there's going to be some decisions that are going to be made during this that we have to put a lot of thought into it, but we also have to make some of those decisions for the good of our community. And I think we're going to continue to have to do that over the next 30, maybe even 60 days. I think that's about all I've got. If any of you have any questions for me.
Roy Dunn, Alan, how's the field burning going, and how's that affecting the county?
Well, we had a pretty good burn season. We had, I think the last time I looked, Roy, over 1,500 burn permits had been put in. There's a couple days we had over 100 permits that were put in. I've had good comments back from the fire departments, knowing where the burning is taking place in their districts. And there's even been several of the calls where the fire departments have not had to respond or only respond with one truck, because calls, as we talked about the burn permits, one of the issues was people with cell phones just driving down the road and calling in a fire. We've seen several of those the last couple weeks, but dispatch or the fire departments themselves were able to look on our map and see that a controlled burn was in the area and either contact the person doing the burn or only sending one truck out to verify it being a controlled burn. So I think all in all, we had a pretty good season. I think it's about to come to an end. Also, there's enough green grass and most of the pastures have been burnt off. There may be a little bit of CRP grass yet to burn, but I think we're pretty well done with it.
This is Commissioner Waymire. Does anybody else have a question for Alan?
Hey, Colt, this is Derek, I might just piggyback on what Alan said a little bit. And Alan, that was a terrific report. I appreciate that. what I would add is, irregardless of what happens at the federal or the state level, or even the decisions that we make here at the local level, COVID-19, we're not a month away from it being eradicated. Like, it's not going anywhere, and I don't think it's going anywhere until we develop a vaccine. And I say that so that the commissioners understand that this is something that at a staff level, we are going to be dealing with, I think easily through 2020. Now, there will be ebbs and flows in terms of how overwhelming it is, but if you look at what the federal government is talking about, and one of their strategies for opening is to open up, but use mass testing. So frequent, mass testing to identify those people that have it and then put them in quarantine. Well, who do you think was going to be responsible for that if that ends up coming to fruition? I mean, if that's the model we go with, I mean, all of a sudden we're potentially woefully understaffed. And so it just, so much is still yet to be determined. But even if we get back to some semblance of normalcy for the people who are staying at home right now, it's going to be anything but normal for us for quite some time. And just want to make sure that you have that perspective, because I don't see any way around that. Thanks, Colt.
All right, Nick.
Good morning, commissioners. This is Nick. I want to start out by echoing Derek's response about the health department. I will tell you, working over there for the last 3 weeks, hand in hand with them, there is some very good employees over there. They're carrying this public health emergency very well. With that, we have had to establish a lot of communication through different branches and face-to-face meetings, with working with OFP, Advent Health, and all of us in some way having involvement with testing or needing to get results back to each other. We've been working hard on what that communication looks like. And I really couldn't be more pleased how everybody has jumped on board to help with that communication. With that being said, it's been nice and a breath of fresh air. As Derek alluded to, we have only had 12 actual tested positive cases. And, right now we're knocking on the door of 200 negatives. And we're testing, if you look at the KDHE website, we're testing more than some of these other areas are. We're averaging a lot more tests, which has been good. We've been lucky to get testing supplies from the stockpile. Tom, Alan have done a great job getting those. One of the hardest things we've dealt with is staying on top of the testing guidelines, because testing guidelines have changed. When this first started, KDHE was so overwhelmed, and then Quest was our next option. We got behind on the testing. It wasn't our fault. It was everybody was sending tests to them, and they weren't ready for it any more than we were. We're seeing now KDHE's turnaround times have greatly increased, even to 24 to 36 hours. So with that kind of turnaround, we're able to successfully get people in and out of quarantine better. We're able to not have these individuals in quarantine for up to a week if we get those tests back. So that's been a positive. And I know at the beginning, there was a lot of people that did get put into the quarantine isolation that their patients were tested, to say the least, because of that. But we are seeing more tests come out. We're seeing the availability for rapid testing. We did receive some tests, but we're still waiting on FDA approval on them. So that'll be a game changer when we go with that. But other than that, I will say the health department, OFP lab, the Ottawa physicians themselves, and Advent have been good partners to work with. And we we continue to look with our first responders and what that looks like. PPE has been given to us by the stockpile. I know we're not using a lot of it. EMS has done a great job on keeping those supplies, making sure we can get them to those that need them in the time that we might have a potential case. Our communication center stepped up. We are now screening every caller that calls in just to protect the first responders and asking simple questions that give us an idea whether we should take precautions or not. And the public's accepting it well. So kudos to them and kudos to the communications center for screening those and truly being the first responder to help out our responders. With that, we're seeing a great team effort across the board. I will tell you that the health department is going to have to start opening up some essential functions. We're in the process now of looking at doing immunizations for our infants and working with OFP to see what that's going to look like. While we're doing that, we also have family planning that's going to have to start opening up. We've got patients that are going to have to be seen. So Aaron, Robert, Jennifer are doing a great job helping establish policies to what that's going to look like and how we can serve the public, because we can't just shut down and not start back up. So you will see by May 1st, I believe some of these functions will be opening back up, and I can promise you we'll have a good plan to keep that staff safe. The biggest stressor that I have, and I believe a lot of our responders, is we've been lucky. We haven't had responders go out. We have been able to successfully test responders and get them back quickly to work. But if we continue with the social distancing, we continue with everything, we're keeping our essential staff doing their job. And that's something the public needs to know. That's something that our department heads need to know. It's important that we're taking care of our people. And I feel right now we're doing a great job. One thing I do want to comment about, and this is on a very positive note, last night we received our evaluation from ACE accreditation for the communications center. I know this has been something that we've been working on pretty much since we took over the communications center, and it was a challenge that I gave. We had some great people. Emily, Abby, Jenny have been doing the QA and the stuff on the calls. We're on the final steps. We were able to, as you guys well know, in January, we missed it by 1 point. And we got 3-month extension on it. Last night, we got nothing but positive comments and good feedback from the evaluators. So I anticipate that by the end of this month, I'm going to be reporting to you that we're the second ACE accredited dispatch center in the state, which is humongous for what we've done. And it shows what a great job our dispatchers continue to do. And with that, it couldn't come at a better time, because as some of you have seen, this is emergency telecommunicator week. So getting news like that on a week that does spotlight our communication center is great. So with that, Alan did bring up that we had conversations with Dr. Ransom. I will tell you, he's doing a great job for the county. He's doing a great job for the public, and anything we've needed, he's working hard to bridge gaps between Advent Health or bridge gaps to after-hour testing of our public safety. So I do want to give kudos to him for the work that he's done to help make our job easier and to help us guide through this COVID event. So with that, I'm open for questions if you have any.
All right. This is Commissioner Waymire. Thank you, Nick. You're a busy guy and you're doing a lot of things and you're doing them well. We appreciate you. I'll move on to Casey.
This is Casey. Hi, commissioners. Hope everybody's doing well. I just want to give a quick update. So I continue to update the public daily with our numbers that I received from the health department. We did make a change April 1st on what goes out daily, just including a little bit more information based on all of the questions that I was receiving. So if you've seen that update that goes on the website daily, it looks a little different and includes a lot more information. And we've received a lot of good feedback on that. Still get questions here and there. They've definitely slowed down, but still receiving phone calls and emails daily, just with random COVID questions or questions about what they should do or why is this business open, etc. So that has slowed down, still getting them. We're also still updating the website with different things daily. So like after Alan said this morning about hoping to get more people in face masks, we'll definitely push that out again more. I get on a daily conference call with the state just to listen in what's going on statewide, and then also have a conference call with other Kansas PIOs twice a week, and that always has helpful information. So that's kind of what my world looks like. Things have definitely calmed down compared to the first few weeks, so getting back to some of the daily communication things I was doing before this all started. Anybody have any questions for me?
This is Commissioner Waymire. I don't hear any questions. You know, it's a slippery slope to highlight anybody who's doing anything right now because we have a whole team of people who are doing good. In a bad situation, this county's handling it well. But maybe because communications is so parallel with what we do as commissioners, you know, we're a link between county government and people. I do want to say I've got a lot of good feedback about our communications and how easy it is to get good, reliable information. And, you know, a lot of people may not realize too that when this started, there was a concerted effort that, you know, the fire department, the cities, the hospital, county, not everybody's going to send out a bunch of different messages and we're not going to compete. That point of information is going to come from the county. So, you know, those entities all trusted us to do a good job, and Casey's done an excellent job. You know, especially today, getting a large group of people to get their information from a reputable, reliable source is a feat in itself, and to do it on such an important subject as this is great. So thank you.
Hey, Cole.
Thank you, Cole.
This is Derek. Before we move on from communications, and certainly echo everything you've said, Lord knows I've gotten a lot of compliments from the team internally, from other staff members about how lucky we are to have Casey. So certainly agree. That being said, do you, 5 commissioners, is there anything, you know, we've been so focused on pushing information outward and keeping the public apprised of everything that we're doing. Is there anything we can do better for the 5 of you? While we have you all together, I think it's a good time to talk about that. Are you content with the info that you're getting? Are you able to adequately, to the extent you're getting calls, do you feel like you're able to adequately explain to your constituents where we're at? Any feedback you can give Casey and I on that would be appreciated.
This is Commissioner Dunn. I have a question. A motor vehicle department yesterday, and they answered it. People that have personalized license plates, we got a letter from the state that said we had to go personally to the courthouse to get our our personal tags replaced, but motor vehicle will let you send in your your taxes and tag amount, and they'll take care of both of those. So I just wanted to mention that if you have a personal license tag, you can just send it in like you're getting your other tags. That's all.
All right. This is Commissioner Waymire. Does anybody else have a comment regarding whether or not the internal communications they're getting from the administration and the rest of our staff is enough to is sufficient to help you address public concerns, public needs that you get?
This is Commissioner Howard. I'm fine with what I'm getting.
All right.
It's Commissioner Stottlemyre. Everything's been very sufficient so far.
All right.
This is Commissioner Dickinson, and I have not had a lot of public questions. I think that we are getting that information out to them in a great way. So yeah, I'm good. I do appreciate that's kind of the way I feel like I'm staying connected with what's going on.
Good. Good. All right, Derek, I'm planning on moving on to the next.
That sounds great. Thank you.
All right. Sheriff Richards, are you on?
Yes, sir, I am. Can you hear me?
Yeah, I am. Go for it.
Okay. Hey, I just wanted to kind of echo some of the things Nick said. This is Telecommunicators Week, and so we, the Sheriff's Office, we really appreciate the service that we get from our dispatch center and the effort that that the dispatchers are putting in, especially with what's going on. I know they're fielding a lot of different type of questions they're not used to, and they're doing great there. And the information that they're getting to from the callers is important for our first responders, and so we appreciate what they're doing there. The Sheriff's Office is also the place where we're getting, if people have complaints about people that they believe are supposed to be in quarantine or isolation and that they're breaking that, we're the people that are investigating that. I just want the commission to know that all of those complaints that we have received and the calls we've fielded do get investigated. And so far, we have not had anyone that is supposed to be in quarantine or isolation that we have found has been violating that. There are some misunderstandings with some people in the public about who's supposed to be, or maybe they don't understand that someone has actually been cleared, and so that they're off of isolation at that point. And I think that's part of where the concerns come from at times, is just they don't understand that somebody has been cleared. But every investigation we've done, there has not been anyone that has been violating what they're supposed to do, and that's a good thing for each of us. As far as our staff is concerned, we have had a few calls where we've responded to locations where there is someone there in isolation or quarantine. We do have the personal protective equipment for all of our people. I want to thank the EOC and EMS for that through the way that the system is set up for us to get our resources and equipment has been working well. And so we have had that. Also, EMS and the health department have worked with us to help us understand what it is that we need and how we need to protect our staff when we are responding to those type of calls. And based on some of the guidance and input from them, we have developed a written procedure and guidelines for our staff on those things, and that's been pushed out to everyone, and everyone is accepting and following that very well. And so we are taking those procedures, and we're taking those very serious. Our staff is we're still operating full staff. Everybody's healthy. Some of our work does look a little different. Our calls for service have decreased. We will never complain about that, and that allows us to get a few more projects done that maybe we wouldn't have been able to otherwise. People are working a little different. Some people the core of what we do, obviously we can't just work from home for that, but those that are able to do work from home, we're doing that so that we can social distance as best we can. Early on, we implemented a lot of changes and addressed the way we were going to be conducting business in the jail. And because I think in large part because of that, we've been fortunate that we have not had anything happen in our jail that have other places. And we do have procedures in place and practices in place to handle isolation and things like that in the jail if we need to. We still don't have just members of the public that are coming into the facility at all. Visitation is still done through phone and the kiosk video, kind of like we're doing this meeting. And our staff, anytime that they're dealing with inmates, they are wearing masks. And that's just done out of an abundance of caution to help protect the inmates that are there. So overall, I think things are going well. Our demand for our services is really low, but I believe that once things get back to more normal and when the district court opens back up, and so there's court cases and more warrants being issued, I think we're going to see an influx of demands on our service at that point. And so we're ramping up and kind of preparing for that at this point. So other than that, unless any of you have questions for me, that's all I have today, Commissioners.
This is Commissioner Waymire. All right, hearing no questions, I'll move on to Janet, Clerk's office. Are you there, Janet?
Good morning, Commissioners. Yes, as Alan and Derek both mentioned, I'm working with the EOC team to track all these expenses and including all of our personnel costs that we have that are in addition and in regards to this response. And also moving forward with the budget at the same time. I know that obviously can't be our focus, and we have slowed down our calendar a little bit from where we were at originally for getting all the meetings set up with our department heads and with the commissioners. But we still are working on that. I have Tammy working on some budget things, and I'm working diligently on it. All of our department heads pretty much should have their budget unless they're actively involved in this response. Obviously, I haven't been in contact with them about their budgets because they have more pressing needs right now. So Gayla is working a lot on all of our numbers for personnel, and Sari is getting involved in that too. So we are all pushing forward behind the scenes on that. Obviously, this COVID is our focus, but we need to be ready to move forward on the budget as soon as possible. We still have to meet our statutory deadlines for August for our budget process. So, and as you know, with $16 million in tax revenue that we plan to collect every year for our budget and other revenue coming in that has to be budgeted, we still have to put a large focus on the budget when the time is right. So we want to be ready for that when that comes about. So only half of my staff is working this week. I'm in the office and Betsy's in the office, and we've planned for this already to be cross-trained. So if anything ever happened, we would be ready, and Betsy's jumped in on paying the bills. So the checks are all going out on time today, which is awesome. I'm really proud of my staff, and Lynn and Debbie covered the previous 2 weeks and kept everything going while Betsy and I were away from the office. So I think all the other departments in the courthouse are doing the same, kind of working in shifts, and all the departments are working really hard to keep all the services available and finding solutions for our citizens to still provide all of these services that we need. So kudos to all the departments, with a special emphasis on all the ones that are actively involved in the response to this.
All right. This is Commissioner Waymire. Any questions for Janet? Right, I will move down the line to David Lee, Public Works Department.
Commissioners, just real quick, want to update you on the Finney Road project, the bridge that we had some wing wall issues last year. Those wing walls have been replaced. High Plains did a great job rebuilding those walls, and our staff assisted on that, and we cleaned out the creek channel and armored the bank next to the road. There was a lot of erosion right there, so we have taken care of that, and hopefully it won't be an issue anytime soon. We've also been working on several minimum maintenance roads. We've had issues with, I suppose, kids out playing on four-wheelers and 4x4s and that sort of thing. We've been hauling rock on a daily basis to our various districts. We've installed 8 crossroad tubes and entrances the last couple of weeks and cleaned out and repaired ditches in 5 different locations in the same 2-week period. We've also been patching some of our asphalt roads. We'll continue to do that. We've also seen an uptick in the trash that our road and bridge staff are having to actually go out and pick up and dispose of properly. In fact, today we've got reports of mattresses located in a couple of different areas that we're going to have to dedicate time to take care of. So in a nutshell, we are taking advantage of the good weather and bringing our roads back into good repair. Happy to answer any other questions that you may have.
All right, this is Commissioner Waymire. Hearing no questions, we'll move on to commissioners' comments and board reports. Let's start with Commissioner Howard.
Okay, I don't have too much. Of course, we all know how much we appreciate our frontline people and our employees. So we've said that before and still feel the same way. The only other thing I want to say is I do want to put out a thank you to all our people in the county that are following the stay-home orders and doing their part in the social distancing. Really appreciate that, and I know a lot of people are doing that. On the other side of that, in my area particularly, I know that there are a lot of people that are ignoring that and just going about their business and doing whatever they feel like. And I do know there's some businesses that have stayed open that have no reason to be open. And I just want to say that's disappointing. The more of them would get on board, and the better off we would be. And that's pretty much all I have. I haven't been to any of my boards or anything. We haven't had any of those, so that's all I have.
All right, Commissioner Dunn.
Nothing to report. I got a ECAN meeting tomorrow by phone, another conference call. I can't convince my wife that I need to stay in the house and not go out and mow the lawn, but I guess that doesn't work for us homebound people. Anyway, I just appreciate what Commissioner Howard said. Appreciate all our county workers and what they're doing, and I also seen a lot of people kind of fudging on the stay-at-home order and that sort of thing. So I just wish everybody to be well and stay healthy and try to comply so we can get over this.
All right, thank you. Commissioner Dickinson?
Yes, the only thing this is Commissioner Dickinson. I attended the Food Council meeting by phone on the first Monday. Their main emphasis is going to be with people out of jobs and kids out of school is to make sure that everybody has sufficient food. And they're already talking about when the school's session is done, how they can continue to provide food and do it safely. So anyway, those talks are already happening. The only other thing I've been doing is attending once a week. The governor has a call-in for elected officials, which includes our Kansas House and Senate. And they usually have updates from because all of this is happening, and now they have to figure out how to pay for all of this. And so the the Department of Labor is talking about the unemployment, all the unemployment and how many calls they're getting. Department of Commerce is providing information on the different programs that are available for businesses that are having to close. And the National Guard representative is giving reports on possibly opening recently closed hospitals and nursing homes in case they are needed for additional medical facilities. So it's been really interesting to see how people are pulling together in all of these. So if somebody that is out of a job or a company that is having to close, there are resources available. So please reach out if you are feeling in a crunch and you don't know where to turn. There is help available. So I just want people to realize that they are working on that. We aren't just leaving you in the dark, and we're all in this together. And that's it.
All right, thank you. Commissioner Stottlemyre.
Yeah, I really only have to thank everybody, basically our staff, for I think the outstanding job they are doing. And I do believe most people in the county is you're going to have, people just can't stand it any longer. But I think for the most part, they're doing a pretty good job. I did report last month that was interviewing for the position, the Solid Waste Authority coordinator, and we have offered a job, and the lady has accepted. It's a Shay Hanasar. She lives in Osawatomie, and she is as a week ago last Monday. She is the new coordinator of the Solid Waste Authority. And as the chairman of the management committee, I've been working via email, and the only thing she's disappointed in that I think first thing she wanted to do when we interviewed, she wanted to get out and meet with everybody and go to all counties, and that kind of went to the wayside. So, but she is really anxious to do that. She's doing a big job right now of redoing our website and some of our accounting, changing some of the way we do things. And I think she's doing everything she can do at this very point. But I'm sure as soon as we get through this, she wants to come around and meet with all of our solid waste facilities and meet with the commissioners. And I'm sure she's going to do a very good job for us. And that's all I have at this time.
All right, thank you. This is Commissioner Waymire. I've attended FCDC meetings via conference call, as well as Elizabeth Layton Center. One notable thing, Elizabeth Layton Center was just recently approved for Triple P, the Payroll Protection Plan loan grant thing that comes out of the federal government, and the stimulus that was approved. So that's huge for them. Obviously, their revenues are down because what they do is face-to-face. They have a lot of professionals that work for them, so they have a sizable payroll, and this really helps protect that organization. Otherwise, that had been there'd be a big blow to that very important organization. So that's a blessing. We're happy about that. Otherwise, nothing else out of the ordinary to report. Anybody have anything else before we look for a motion to adjourn?
The only thing Mr. Stottlemyre, Mr. Waymire?
Yes, go for it.
I think I did kind of forgot to mention, we have had tremendous call for our Adopt a Bike program through the Lake Region RC&D, and I think it's probably due to there's so many kids are home and they have nothing else they can do, maybe get out and exercise and ride with their family. So all they got to do is go through an agency in their county. In Franklin County, it'd be Hope House and ECAN right now. The rest of them are probably not be able to do that. So just want to let everybody know we've had a really big 2 or 3 weeks. That's all I'm getting done is delivering to the 6 counties. So I just wanted to put that out there. If you have an entity in your county that does represent that, like an ECAN or a conservation district, or a Hope House or something like that, just contact them, and I'll do the best I can to fill their orders. Thank you.
Appreciate you, Don. Commissioner Dickinson, I heard you start to say something. Did you have something?
No, I did not. Thank you.
Okay, all
It
right.
was actually me. This is Casey Brady.
Okay.
I have one more quick thing. The census is still ongoing, so if you haven't filled out your census, please go online and get that done.
All right,
That's it.
good deal. All right, this is Commissioner Waymire. Would somebody like to make a motion to adjourn?
Commissioner Stonemeyer,
Commissioner.
motion to adjourn.
All right, would someone like to make a second?
Commissioner Howard, second it.
All right, all in favor?
Aye.
All right,
Aye.
any opposed? We are adjourned.